Hello and welcome to this Lancet Moment. Today we are discussing antimicrobial resistance, and with me in studio we have Dr. Prinsloo, a leading expert on the subject. Dr. Ben, thank you so much for joining us.
Thank you.
It's all about when do you need antibiotics, and that's the biggest thing. For me, I think it's hard to try and figure out when is my child sick enough that I need to give them antibiotics, and when I'm really sort of pushing for that with a doctor, and I know I shouldn't, but what are the sort of guidelines? How sick do you have to be to take antibiotics?
I think that's a challenge for most doctors and healthcare workers also, because a patient will present and then the doctor will have to decide, is this a viral infection where you do not need antibiotics, or is this a bacterial infection? Now, there might be some clues as to which it might be, but it's not always that simple, especially with upper respiratory tract infections like sinusitis or ear infection or throat infections. Those are usually caused by viruses, so you do not need antibiotics. But they might also be caused by a bacteria where you will need antibiotics. So I think it's very important that when a patient goes to a doctor, that they give a good history as to for how long have they been unwell. And I think also a tip for most parents is if your child develops a fever, that's very subjective. One should have a thermometer and you must take the temperature, so you can tell the doctor the child has got a temperature of 39.8, because sometimes the child might feel warm and it might not be a fever that warrants antibiotics, for example. So communication between the healthcare worker and the patient is extremely important. What they do in the UK is if a patient comes to a doctor, especially with children, the doctor will give a script to the patient and say, we give you this prescription for antibiotics, but first wait 48 hours to see, is the child getting progressively worse, or is the child actually becoming better? So if you then still need the antibiotics, you can go to the pharmacy, but you do not necessarily have to start using the antibiotics immediately.
And I think that also speaks about our culture in that we want to rush things. So we don't have the patience to wait an illness out. We don't want to see if someone's going to get better. We want them to be better immediately.
Yes.
And so we think antibiotics is going to be the quick fix.
Yes, we need that quick fix. If a doctor tells you, unfortunately, you will be unwell for 2 weeks, it's a virus. You must take symptomatic drugs like just to relieve the congestion or the headache. Patients might feel, but why is he or she not giving me an antibiotic, because that will make me well quicker, and that's not the case, because if it's a viral infection, it will take the 2 weeks or 3 weeks before you get better.
Okay, so it's really a mindset change for us as a community to know that sometimes we just have to give our bodies the opportunity to work the illnesses out.
And the thing is, there's different ways of preventing infection in the first place. So general things like washing your hands, because many of the germs are actually transferred by our hands. So when you sneeze or you cough, you must wash your hands. And something else that's now more important is vaccines. I mean, we are used to vaccinations for children, but we now get vaccines you can give for adults also, and they might actually prevent pneumonia. So one must make sure that your children, the vaccine schedule is up to date, and then adults who qualify should also be vaccinated, because if you're vaccinated, you actually prevent the infection, and if you prevent the infection, you don't need antibiotics.
Doctor, thank you so much. It was really an insightful conversation. If you'd like more information, you can visit www.lancet.co.za. Thank you for watching and take care.